Hello and welcome everyone. This is Dr. Zainab Habib. As you know, we have all gathered here today to observe World Hepatitis Day and raise awareness about hepatitis B, a disease that affects millions of people worldwide. I welcome you all to this webinar where we will discuss the importance of hepatitis B prevention, diagnosis and treatment. Today we have an eminent speaker, Dr. Syed Habib Karim, who will share their expertise and experiences with us. But before we begin, I would like to take a moment to acknowledge the significance of World Hepatitis Day. It's a day to remember those who have lost their lives to this disease and to renew our commitment to fighting hepatitis B virus. As the slogan for World Hepatitis Day 2024 from World Health Organization WHO is it's time for action. So let's get started. Handing over to Dr. Syed Habib Karim.
Hi everyone. Am I audible to you? If I'm audible, kindly write in the chat box audible. If my video is clear, you can write video is clear. Hmm? Am I audible? Please write into the chat box audible. Am I audible? Yes, so welcome all of you for this webinar. We have been trying to connect all the patients worldwide and patients from Cameroon. I can see patients from Cameroon, Kenya, Nigeria, and yes, also from India. Nice to see all of you. Thank you so much for joining, and let's begin the session. So we have divided the session into two parts. We have divided this webinar into two sessions. One would be the lecture on hepatitis B awareness and treatment, and the other would be the question answer session. So let's begin with the lecture session. If I'm not audible, you can write into the chat box that the audio is not clear. Okay, because from here everything is clear. Yes, so we are here. The slogan, as Dr. Zainab said, this year's slogan for World Hepatitis Day is "It's time to act." It's time for action. That someone has written as "time for action" in the net. It's okay, whatever. It's time to act. So let's begin the lecture. So hepatitis B, it was formerly known as serum hepatitis. You see, it's a global burden around the world. Uh, there are two types of hepatitis, acute and chronic. We are going to focus here with regards to chronic hepatitis B infection. So around 350 million people worldwide are living with chronic hepatitis B virus. That means they are the carriers of hepatitis B virus. So HBV, hepatitis B virus infection, is a leading cause of liver disease, including liver cirrhosis and liver cancer. That is, we call it as hepatocellular carcinoma. So the challenge in this treatment is there is no functional cure available so far. Now, the objective of this presentation is we will introduce to you to a drug called Whim Plus B. We will share our clinical experience with you. We'll also give you a detailed mechanism of action and what are the clinical outcomes and the potential it has for a functional cure. We will discuss all these things. Am I audible? Please write into the chat box. Yes. Nice. Good. So as I said earlier, that hepatitis B virus infection, it attacks the liver. That means all the pathological condition leads to liver only. So the pathogenesis and the impact of the liver goes on like this. There is entry of the virus. Okay, then there is replication of the virus. It affects the immunity of the body, and then it leads to chronic infection. This chronic infection, this chronic hepatitis B, leads to cirrhosis of liver and finally hepatocellular carcinoma, which is known as liver cancer in layman's term. And that is the reason, this cirrhosis of liver and liver cancer, these two are the reason for the death due to hepatitis B virus infection. Just a minute, someone here has. Okay, so this is the drug you can see in the screen. It's a herbal extract based drug for hepatitis B virus, and it's a FDA approved formulation, Unani formulation. It was formulated to inhibit viral replication and to support liver health. And we will discuss certain case studies as well. Let's go to the composition of Whim plus B. So before we discuss about Whim plus B, let me say something about the antiviral medication which is available right now. That is tenofovir. So tenofovir, which is ART, since HBV is also a retrovirus. So tenofovir is used in HIV and HBV, since we treat many patients of HIV also. So let me tell you something about tenofovir with regards to hepatitis B. When you start tenofovir, uh, there is certainly suppression of virus. Okay, within 3 months, the viral load, that is the DNA PCR quantitative viral load, that will come less than detectable level within 3 months, or say maximum 6 months with tenofovir. But you cannot stop the treatment. Once you stop the treatment, then there is rebound of virus. Okay, so we should understand this. So this was supposed to be explained tenofovir. So this is the main limitation of this tenofovir. And apart from this, there are many side effects. We know, as I discussed, that hepatitis B, it's a pathological, it creates a pathological condition of the liver. So tenofovir has liver toxicity, that is hepatotoxicity. It affects the liver. So that's the reason, if you are affected with hepatitis B, the doctor suggests you not to start tenofovir unless your this thing, hepatitis B viral load goes beyond 2000. Because once you start, you cannot stop it. So now let's go to Whim plus B. So as I discussed with regards to Whim plus B, this is the medicine which can you see this medicine? This Whim plus B. This is the medicine which we give. Many doctors purchase it from us, and this one. Yes, this is the product Whim plus B, which we are giving to many doctors and many patients around the globe, and we are getting a very good result. I'll share the case studies with you. Let's get into the botanical composition of Whim plus B. So these are the technical terms which you can see in the screen as well. Phyllanthus neruri is one of the key ingredients, active ingredient in Whim Plus B. Then we have licorice root, milk thistle, curcuma longa, and Andrographis periculata. These have the active molecules are also mentioned along with the drugs which are used. Mechanism of action: four main mechanism of action. Immune modulation. The drug boost your immune response against hepatitis B virus. Okay, and there are several ingredients which acts as antioxidant that has anti-inflammatory effects. And as I discussed, that tenofovir has hepatotoxicity, but here, in the case of Whim plus B, it is a liver tonic. It protects. It is a hepatoprotective drug, so it promotes a liver cell regeneration. And the most important action is antiviral properties, because definitely with this property only the HBV DNA viral load will become less or will come to less than detectable level. So it has a direct action on the HBV replication and HBA suppression as well. So as I discussed, these are the major actions: liver protection, immune modulation, antiviral properties, HBS AG suppression. These things we have mentioned in our clinical studies and all the research papers as well. That which ingredient, which part of the composition of this drug acts, and in which mechanism. So what is HBV DNA PCR? When you start with tenofovir, HBV DNA PCR will show less than detectable level and target not detected. But once you stop it, there will be rebound of virus. The virus will go into millions of copies. We have reports with us. We can share some of the reports with you as well in the question answer session, definitely. So the main focus of Whim plus B treatment is to get HBV DNA PCR negative. Okay. Now HBS suppression and anti-HBS restoration. When you take the Whim plus B treatment, you can undergo these tests: anti-HBS restorative test, anti-HBS test. Anti-HBS test, if it is above 10, that means you are fully, completely immune to HBV infection. That means you are completely recovered from HBV infection. In case of tenofovir, when a patient takes tenofovir, his anti-HBS remains less than 1. We have reports with us to show you. We will show you this in the question answer session. Okay. So this is the main one of the main action of the drug, to increase the anti-HBS, because if there is a restoration of anti-HBS, that means you have completely recovered from hepatitis B. Liver gene regeneration, as I discussed earlier, the herbal components of Whim plus B drug, it promotes liver health. It regenerates, rejuvenates the function of liver. And the studies has shown that the SGPT and SGOT levels, they drop down to normal levels. So these are the summary clinical studies which I will share you. And one more thing which I wanted to share with you, that is HIV and HBV co-infection. Many patients we have found, in our clinical studies, those who come with HIV along with hepatitis B. We will have a next section on this topic, HIV and HBV co-infection. It's a very important topic, because this is more fatal when you have hepatitis B along with HIV. It is more fatal, and the mortality rate is also higher in case of HIV and HBV co-infection. So we will discuss this in our next session, because it's a vast topic. A next a completely new session would be required to complete this topic. This is Lucas from Tanzania. He has given us the consent, because without the consent of the patient, it is unethical to show their picture and to reveal their photos. So that is as per the medical ethics. This is Lucas from Tanzania. He is a genuine, original patient. He has allowed us to show his photo. He also said that he would join us today live. We are in touch with him. So he has, after undergoing the treatment for HBV, That is, after undergoing Whim Plus B treatment, he has recorded negative for DNA PCR, and he has stopped our treatment, and still his report shows HBV DNA negative. So he will definitely discuss with us the quality of life and the productive life, everything. The case study two, the second case study, Fortress Niami. She is a 25-year female. Again, she gave us consent to discuss about her report. Her image is been kept confidential over here, but she is a genuine patient again. And you can see her HBV DNA result. It was 93,539 copies per ml on 10th of April 2023, last year. But this year, in the month of April, when we checked her HBV DNA, we found it is target not detected. And again, we repeated her test in the month of July, it was target not detected. So this concludes that there is improvement in the patient's liver health and a complete well-being. So to conclude, one we will begin with the question answer session. We will begin with the question answer. Please wait. Let me complete certain slides. Yes. This is my contact information because it was requested from many patients. They wanted my personal contact number, so you can see my personal contact number. But for queries with regards to treatment, you need to contact on 9594 000093 and also on info@huton.org. For other related, you can follow me in Instagram and everything. These are our current associates. Kabir Hamza, pharmacist from Nigeria, is one of our associates from Nigeria. Houghton Pharmacy Limited in southern Nigeria. Dr. Felix from Liberia. And Simon Nanfa from Cameroon. He is a very good well-wisher of us. He takes many, uh, he has taken treatment for many patients from us. Every month he takes, I cannot tell you the exact amount of medicine, but every month he takes uh, a good quantity of Whim Plus B drug for his patients. And he's very much satisfied with the result of Whim Plus B. So these are our associates. You can get in touch with them for more review. And in India, I'm personally looking after the patient. So that's the reason I haven't shared anything from Indian doctors. So this is the certification, which you can see in the left side. Okay. This is a collaborative thing with the government of Nigeria. Anything else you want to ask me? I can see the messages are being flourished in the chat box. Okay. So we will soon begin with the question answer session. I'll take those questions which are in the chat box. Let me scroll to the chat box and see if the questions are repeated. Then I will take those questions. Okay. I'll see the questions. Wait. Yes, I'm audible. Please write into the chat box if I'm audible. I've got a question from Sheikh. My HBV viral load is 1000, and my doctor is saying that since your viral load count is below 22,000, therefore you do not require any treatment to be started. What should I do? This, as I explained in the lecture session, that if your viral load is less than 2000, why the doctor suggests that you are not supposed to start tenofovir? Because once you start tenofovir, then you cannot stop. Moreover, it has hepatotoxicity. It will harm your liver. It's a known fact. It's an established fact. And if you stop a tenofovir, the virus will rebound. It will goes on millions of copies. That's the reason the doctors tell you don't start the treatment. Let your innate immunity, your natural immunity, let it fight with hepatitis B. Don't start with the tenofovir. That's the reason. But we should understand one thing, that if you don't start with a proper drug, uh, the other liver conditions like hepatitis B can lead to liver cirrhosis, and it can lead to liver hepatocellular carcinoma. So, Whim plus B treatment prevents you, acts as a prophylactic drug towards cirrhosis of liver and towards hepatocellular carcinoma, that is liver cancer, because it is a liver remedy. I'll also take one question from Ruksar Deshmukh. She has said, please explain causes and symptoms of the disease. The cause is very renowned cause. It's a parenteral route. Parenteral route means away from the intestine. So we should understand that uh, hepatitis B is a blood-borne infection. That you get the disease through blood products only, like tattooing, blood transfusion, and everything. So that's why it is called a parenteral route transmission, and also through sexual contact. So that is the causes. The causes are very popular in the net and everything. You can get more and more details. As far the symptoms are concerned, the symptoms is definitely jaundice is one of the major symptoms of hepatitis B. That is yellowing of the skin and the eyes. Yellowing of the skin and sclera is one of the symptoms. It is associated with nausea, vomiting, and pain in the abdominal. That's the reason hepatitis B is classified in intestinal infection. That's the reason people approach gastroenterologist. They consult gastroenterologist to treat, to manage hepatitis B. But again, if it is listed, it is classified in modern science under intestinal infection, but the route of transmission is parenteral route. That means away from the intestine. So these things we have to understand with regards to modern science. So the symptoms, as I discussed, main symptoms is jaundice and the pain in abdomen, nausea, vomiting, lethargy. These are the symptoms. Anything else? I'm taking tenofovir and my HBV viral load is below detectable level. So now how long should I take the Whim plus B treatment? If you are taking tenofovir and your HBV viral load is below detectable level. Okay, so you have to take the treatment Whim plus B along with tenofovir. Simultaneously, you have to take both the drugs. Then for the first 3 months. Then from the fourth month onwards, we will straight away stop the treatment of tenofovir. We will straight away stop the tenofovir drug. See, unlike when we treat HIV, we taper the dose of ART. But in case of HBV, we have found tremendous result even after stopping it at one go, at one shot. So we will stop the tenofovir straight away without tapering. But this will be done on the fourth month without any gap of hepatitis B treatment. This is important. There shouldn't be any gap of treatment of Whim Plus B. So you take the treatment tenofovir along with Whim Plus B for the first 3 months, and straight away on the fourth month we will stop your tenofovir completely. So by this time, for the 3 months you have taken hepatitis, this thing Whim Plus B for hepatitis B. So there won't be any rebound. This is what our clinical studies has concluded so far. Am I clear? Can I stop the current duct tenofovir? Definitely, as I said in the last answer, you can stop tenofovir if you want to start Queen plus B, but after fourth month, from the fourth month onwards. For the first 3 months, you will take both. This is to prevent the rebound of virus. Okay. So the questions are very much similar. I have taken those questions which are uh, repeated, which have been repeated. Dietary restriction, someone has asked. There is no dietary restriction as such. You can take all the organic food. The main thing is there shouldn't be any sort of addiction. So definitely it's when your liver is affected, so you're not supposed to drink alcohol, right? So you have to avoid alcohol completely. There shouldn't be you should avoid smoking, stop tobacco consumption completely. So this is the dietary restriction. And also cold water, chilled water you're supposed to avoid, because chilled water is harmful for the liver. So these things you have to take. And obviously these certain things are very known to people, like consuming of junk food. These things are not good for the liver as well. So that is understood. So there is no dietary restriction as such. People can have fruits and organic food. Anything else? Any other question apart from this? Someone has asked a very good question. Do your company offer delivering the medicine, or we have to visit? Our medicine is exported throughout the globe, throughout the world. Okay, the government of India has given us export license to the company Houghton Remedies. So the medicine you can get right at your doorstep. For that, you need to contact at the email ID info@houghton.org. You can also get it. You can also contact the helpline number 9594000093. You can get in touch with these numbers and email ID, and they will guide you with all the delivery instruction and everything. Anything else? Ruksar Deshmukh has asked that what precaution. The question is not clear. Is it what precaution to prevent to prevent HBV, or what precaution to be taken during the course of our treatment? So, anyways, I'll explain both. During the course of our treatment, there is no such precaution. Only the thing is you need to use protection definitely while having sexual contact, and you should be loyal to your partner. You should avoid multiple sexual partner. So these things, and this is the general precaution which is given in hepatitis B as well in general. Also about vaccination, if she is asking about vaccination, so yes, hepatitis B vaccine provides at least protection for at least for 20 years, immunization for 20 years, or it may give a lifelong immunity. It depends on the patient as well, but there are certain other factors like vaccination failure and waning immunity. These factors are there. So far we couldn't find a single patient who has said us that he has taken the vaccination of hepatitis B and has come to us. All those patients who taken our treatment, they were having no history of vaccination. What else? What about HIV? Any session? Definitely, we will have a session on HIV as well. Many patients requested us. go live because I used to go live, but it wasn't recorded anywhere. It was just a Zoom meeting. But now we have decided to go into YouTube for the live session, so you can see the pre-recorded session as well. And HIV, it's a big topic, as I said, it's an important topic. I'll first, we will have a session on HIV and HBV co-infection because we have got patients with such condition. So we will go through that. Then I'll get with the HIV. Probably on 1st December of this year, we will have a good seminar. In fact, a webinar also, definitely. Can hepatitis B be curable at any stage? As I said, if it is a chronic stage, then it can be cured. And if it is acute, then generally people approach us in the chronic stage only. So acute, I can't assure anything with regards to acute because today we are discussing about the chronic hepatitis B condition. And one more thing, can HIV be cured or it is a lifetime? That's what I was explaining in the lecture session also. HBV can be cured. Cure means a functional cure. What is functional cure? If you stop the treatment, if you start say if you stop Whim plus B treatment, then the virus shouldn't rebound. The HBV viral load, HBV DNA viral load should remain undetectable level for lifelong. So if you stop the treatment, then the virus shouldn't rebound. The HBV viral load should remain undetectable level for lifelong. Someone has said that I'm not getting the voice. Am I audible now? Please write into the chat box. Thank you so much. Any other query you want to ask? Someone has asked that I want to know that your medicine Whim Plus, does it completely cure HBV or merely controls it? Completely cures. Completely cures. As per the Magic Remedies Act, we doctors are not supposed to use the word cure. Okay. So that's the reason I always prefer to say functional cure. Functional cure. And we have scientifically proven there are many research papers in the net. Many doctors, a pool and panel of experts, they have published many research papers. In those research papers, they have declared, they have openly claimed the word cure for that. There is a possible cure for HBV if the patient takes the drug. They have not saying particularly about a drug, but they said there is a possibility that if an HBV patient takes a drug of any particular drug, and after undergoing the treatment, if HBV infection, HBV viral load comes negative and remains negative without any treatment, that means the patient is fully cured. So that is the meaning of cure. Anything else? I'm not getting any questions in the chat box. Meanwhile, so I would suggest a 5 minutes break. Okay, have a 5 minutes break. And please think, you might be thinking what to ask to the doctor. You can ask, definitely. Okay. Today is your day, so you can definitely ask. So you get back with the questions, and we will have a break, a short break. So, welcome back. We can resume our question answer session. I hope there will be questions in the chat box. Is there any side effects of the medicine? Someone has asked. So, see, these medicines are purely herbal based. Okay, these medicines are purely herbal extracts. And let me tell you, there are pregnant women who take our treatment, lactating women who take our treatment. So this medicine is completely safe for pregnant women. Like even a child can consume our treatment. And there are many patients. We have many patients in that age group also, the child age group. So they all are very much safe. We regularly periodically check their every levels like liver function test and everything, SGOT and SGPT. So all these things are normal. We also check their other parameters like renal function test. So these all are normal. So this is completely safe for pregnant women, for lactating women, and even for a child. Moreover, it acts as a prophylactic treatment. Okay, and it prevents the transmission of HBV from mother to fetus during pregnancy. So these medicines are purely herbal extracts, completely safe, completely safe. No need to worry about it. No side effects has been noted so far. What else? Hello doctor, I'm newly detected for hepatitis B. Can Whim Plus B or medicine help me? I'm from Kenya. uh, as I was discussing about the prevalence, there are many patients who have joined us from Kenya. So around 8% of the population in Kenya they are affected with HBV. If you see the statistics published by WHO, so definitely we will you just drop a message to us and we will our staff will get back to you. There are many patients who take, as I discussed, the associate also. Many associates in Kenya. Uh, you can get in touch with them also, or you can get directly with us. No issue as such. Very important question. What are the blood tests done before starting Whim Plus B for hepatitis B? This is a very good question. I will take this. See, in order to see the results, we would advise you to undergo the following test. I'll write into the chat box what are these tests are. HBV DNA viral load count, LFT that is liver function test, and HBsAg and hepatitis B surface antibody, anti-HBs. So these four tests you have to take. You can also note down HBV DNA viral load count test, LFT. These tests are done during the prognosis as well. Okay, LFT liver function test, that is, then anti-HBs, then HBsAg finally. So before starting the treatment, you can undergo these tests so that after undergoing the course of medication, after completing the course of medication, again you can do this. So you will have a reference. You can compare the results as well. Is there any way we can know how to see live patient cure reports? If yes, how we can download them? Waiting for reply, sir. Okay. Note down a website from us, Cure HBV, curehbv.com. Cure HBV. In that website, we have mentioned the genuine reports and everything. And those reports, those patients who gave us the consent to reveal their reports, we have displayed their reports. Because without the consent of the patient, as I mentioned earlier, without the consent of the patient, we cannot reveal their reports. Reports are meant to be confidential. It is unethical to display to reveal the reports of a patient without his or her consent. So in the website, those patients who have given us consent, you can go through the reports and everything. Many HBV patients who have completed the course of medication and those who have got tested negative for HBV DNA, PCR, and HBsAg, and a few patients provided us, so you can see in the official website, curehbv.com. Okay, note down the website, curehbv, curehbv.com. Visit this website. We have published many reports. Anything else? The chat box is in front of me. Doctor, I want to consult you in person. Please guide further. You can take the appointment number 932-406-2957. In this, you can call me and you can meet me in person. But I would suggest you, if you are staying in India, then only meet me in person, because don't waste your money by visiting the country merely to visit me, because many patients around the globe they take the treatment without visiting us in person. Anything else? Where to buy the medicine? You can get the medicine through online. Through online. Just drop a message in the email ID or in the helpline number. You will get the detail, everything. What are the effect of alcoholic beverage on liver? Definitely, it is harmful for the liver. Prolonged consumption of alcohol will definitely cause cirrhosis of liver. Okay, and patients who are HBV positive, uh, in them also cirrhosis of liver is seen in the latter stage of the disease. So if you are HBV patient and you are consuming alcohol, then definitely it will be more harmful to the liver. There will be more toxicity on the liver. These questions, many questions have been repeated. I am from Morocco. Will you deliver the medicine to our country? Definitely. We can deliver the medicine right at your doorstep. The medicine is couriered, okay, and you will get the medicine. What else? How long Whim Plus B taken and what is recommended dosage? As discussed in the lecture also, but I'll repeat it. The treatment has to be continued uh, for at least 10 to 12 months. The 10 to 12 months is the estimated course of duration, and say is the course of medication, or say is an average which we have found in our clinical studies. There are many patients who take it for merely for 6 months, and those who take beyond say 1 year. But 10 to 12 months is an average period, and we have found many patients negative within 10 months. And within these if they complete this course of duration, the course of medication, okay, that between 10 to 12 months, they get negative. We have lots of reports with us, those who have got negative within 12 months. That means within a year. So the treatment has to be continued at least for 1 year. And if the reports come, if your HBV DNA qualitative, remember quantitative is the amount of virus, right? Quantitative tells you how much the copies per ml you have, but qualitative will be like positive or negative. That means detected or not detected. So if your DNA PCR qualitative test comes negative, that means you are negative. You can stop the treatment. And of course, the hepatitis B surface antibody, that means the anti-HBs test, which I mentioned earlier, that should record about 10. So this confirms that then this confirms that is complete recovery and immunity against hepatitis B virus. After undergoing these two tests, your HbA1c test records negative for the patient. So this takes a minimum average of 15 months, as I said earlier. The recommended dosage: 2 capsules has to be taken along with the meals. We have a customized dosage for some patient as well. You get in touch with us, we will get back to you with the dosage and everything. The general recommended dosage is 2 capsules thrice a day. Anything else you want to ask? For the contact number in detail, I will share you the PPT, the PowerPoint slides. You can take the screenshot of that, or else I would write in the chat box the contact number and everything. Sterling Diagnostic Polyclinic has asked, "Good evening, doctor. I want your medicine for our patient. We can in, how we how can we get in touch with you?" Okay. You need to contact in our email ID info@hooton.org, and also you can contact on the helpline number 9594000093. I'll share you soon. At the end of this session, I will share you all the details, at least the contact numbers and everything, because many people have asked the contact numbers. But before that, I'm clearing the queries with regards to the treatment and everything, because that is also important. Jaguar Thomas has said that, "Do you have any product size and capsules in one box and the daily eating times?" We would suggest you email us. We will show you the medicine directly, and you can also see in the website the videos. WhatsApp. WhatsApp. WhatsApp question. WhatsApp question. Yes, yes, yes. WhatsApp question. Yes. Within how many days my HBV symptoms will be gone? The person has asked that within how many days the symptoms will subside. We recommend you to start the treatment Whim Plus B straight away first. Okay, and within 15 days, the general symptoms like pain in the liver region, the abdominal, which I mentioned in the lecture, and if that the pain, the discomfort in the abdominal discomfort, pain in the abdomen, these things will subside within 15 days, and the feverish feeling that will also subside, and the appetite will also improve. So within 15 days, you can see these changes. Okay, your fever will subside, and there won't be any pain and discomfort in the abdomen, and your appetite will also improve. And definitely this treatment provides this drug Whim Plus B provides as it's a prophylactic drug against jaundice. Those patients who have taken our treatment, those who are undergoing our treatment, and those who have undergone, they have noticed one thing, that after taking the drug, uh, there wasn't any recurrence of jaundice, an occurrence of jaundice. What else? So the contact details have been shared in the chat box. May I take a final question? Hmm? स्टॉप कर दिया क्यों? So the contact details, as I mentioned, that the contact details have been shared, and I'll take a final question. Please, I am from Ghana and I have tested hepatitis B and positive. That means that's what he's saying, and I have taken some drugs. But when I go for the test, it is still there. That means it still shows positive. Can your products help me, and can I get uh, your products in Ghana? See, definitely. As I mentioned in the lecture session, Fortress patient, she's from Ghana. Okay. Now, what you are asking me is that after taking the drugs for hepatitis B, your test still shows positive. So, what the drug which you are taking, that is tenofovir. So, when you take tenofovir, your viral load, DNA proviral, DNA PCR viral load, quantitative will be less than readable. If you do qualitative, it will be positive, to be positive. So to bring the report, to make the report negative, okay, to get into to be negative, to become negative, you need to take Whim plus B drug. Okay, after undergoing Whim plus B treatment, your HBV DNA PCR qualitative will come negative. Say negative, say non-reactive, say target not detected or not detected, whatever the terminologies. So the test which you are mentioning, that it is still there. It is still there because your qualitative test is showing positive. So we must understand, as I said in the lecture session, tenofovir suppresses the virus. It will suppress the virus. It won't eliminate the virus. Okay, that is the reason your DNA PCR qualitative is showing positive. Okay, it is showing the presence of HIV virus, even though the quantitative is showing target not detected. But if you undergo the treatment of Whim plus B, your after undergoing course of medication, your DNA PCR qualitative will become negative, and your anti-HBs would be about 10. That shows complete recovery from HBV. Definitely, you can get the product in Ghana. You can get in touch with the patient Fortress. She has given the consent to highlight her name and everything. So she has, and after undergoing our treatment, she has become negative. Any other question? I hope this was the final question. All other thing I think I have covered. So after many requests from all the patients on the globe, we decided to keep this webinar on World Hepatitis Day. And as the slogan for this year's World Hepatitis Day is, it's time to act. I would say it's time for action. So definitely, uh, we have uh, we have acted, okay, in whichever way we could, and we uh, request all of you to come forward, empower the health, and let's fight together against this disease. Thank you so much for listening. Thank you so much.